to increase at the end of February. If the same pattern will occur this time around, we may see cases peak mid-September. However, these figures will greatly depend on the further improvement on compliance of minimum public health standard, shortening the interval between detection to isolation, faster vaccine deployment, and the granular lockdowns that we are all doing right now. As seen in these graphs, next slide please, there is continuous detection of variants of concern in the country. Since its detection in July, the Delta variant cases, these are the orange bars, showed steady increase and has already replaced the beta, the red-orange bars, and the alpha, which are the red bars, variants as the most common lineage detected on each sequencing run. This coincides with the start of a steeper rise in the number of cases in July, similar to what we saw previously at the start of our April peak in cases with the spread of the alpha and the beta variants. Next slide. Also, we saw a 20% increase in the samples being tested in the recent week versus the first week of August, from an average of just 56,179 tests per day. We are now averaging 67,692 cases per day. Other than increased transmission by variants of concern contributing to this additional detection, ramping up of our active case finding and contact tracing contributed to this increased testing and detection of additional confirmed cases. Looking at which areas are contributing to the national increase, we have observed that while the increase in cases were from the NCR plus areas last March to April, the current increases were observed in all island groups at almost the same time. But the rate of increase was fastest in the NCR plus and the rest of Luzon areas. This observation is reflected in our average daily attack rates and two-week growth rates. Next slide, please. All regions showed a positive two-week growth rate, with the highest observed in Caraga at 112% and BARM at 107%. There were 12 regions at high-risk average daily attack rate, and this included all Luzon regions with the exception of Mimaropa and Region 5, all Visayas regions except Region 8, and all Mindanao regions except BARM. But in this table, additional observations are as follows. The NCR, Calabarzon, and Region 3 had two-week growth rates more than 100%, 3 to 4 weeks ago, but this two-week growth rate is lower in the recent 2 weeks. For the National Capital Region, it showed the largest decrease from 138% to just 48%, followed by Region 3 from 114% to just 51%, and Calabarzon from 126% to 73%. Similar reductions in two-week growth rates were also seen in Region 7 and 10. But there were more regions which showed increase in two-week growth rate. And while NCR and Calabarzon had the highest average daily attack rates, Regions 2, Region 3, CAR, and 4 were among the top 5 regions. Lastly, we noted that though NCR had the highest average daily attack rate, it had maintained a low-risk total COVID-19 and ICU bed utilization. The 5 other regions with the highest ADARs are Calabarzon, Region 2, Region 3, Region 10, and CAR. They reported high-risk total COVID-19 and ICU bed utilization. Next slide. This table also shows that 111 or 92% of provinces, highly urbanized cities, and ICCs were either at alerts level 3 or 4. And of the 12 regions we flagged as high-risk case classification, there were 9. Majority or all of it were under alert level 4, and these were NCR, Calabarzon, regions 2, 3, 5, 7, 10, 12, and CAR. Areas highlighted in pink have detected Delta variant cases in their localities as of the August 27 run. Looking at our mortality data, we noted the following. Next slide, please. Our average deaths per day for August now at 114 per day, higher than the one reported in June. But looking at the rate of increase of deaths, we noted the following. During the case increase from February to April, we saw deaths increase by 100% from just 34 in February to 68 in March, and further increased by 98% from March to April. However, in this current case increase, while deaths also increased, the rate of increase from July to August was at 18%, from 97 deaths to 114 deaths per day. But we are interpreting this very cautiously, as there may be late report of deaths in the weeks to come, and this percent increase could be higher by then. We also observed that Region 7, a smaller region than the National Capital Region, Calabarzon, and Region 3 had slightly higher deaths at 22 deaths per day. Next slide. Lastly, let us look at the estimates we had for NCR and the plus areas and how we have fared after about weeks of implementing these responses. For NCR, the current active, severe, and critical cases were below the estimates for August 31. Factors which may have contributed to these figures include improvements in the implementation of our PDITR strategies, compliance to minimum public health standards, vaccine deployment, and the implementation of granular lockdowns. Next slide. We also saw a similar trend for Bulacan, whose current active, severe, and critical cases were lower than the August 31 estimates. Next. However, we had a different observation for the other plus areas. Active cases were twice what we have projected at 12,589 versus the 6,233 to 7,791 projection. The reported severe and critical cases were near or within the range estimate. We have 86 severe cases and projections ranging from 93 to 116. There were 58 critical cases as of August 29, and projections for August 31 were 57 to 71. Next slide. For Laguna, there were also higher active cases for Laguna at 9,208 compared to the 3,352 to 3,944 projected numbers. Severe cases were within the range at 65, but critical cases were slightly higher at 49 versus the projected 31 to 37 cases. Next slide. And for Rizal, they had twice the number of active cases at 5,470 versus the 2,118 to 2,494 projected numbers. Severe cases were slightly higher at 48, but critical cases slightly lower at 13 versus the projected numbers. We have taken note of these comparisons. Note that these projections were based on a number of assumptions. First, how mobile we are. Second, the rate of Delta transmission. Third, vaccination rates. Fourth, the level of adherence to the minimum public health standards. And last, the interval between detection and isolation. We are regularly reviewing these assumptions so that we can explain the higher active cases than what we are projecting. So our key actions, first, of course, is the strict enforcement of minimum public health standards, especially in areas or activities that are included in our 3Cs frame. That would be areas which are closed, crowded, and those with close contacts. Second, active case finding and immediate isolation in granular lockdown areas. So this is one of the advantages of having granular lockdowns, that we can do active case finding and immediately isolate those individuals who are positive or who has symptoms. Third, ongoing augmentation of our health system's capacity. Fourth, continuous monitoring of cases and healthcare utilization for adjustments in our policy and response. And last, continuous implementation of our border control policies, restrictions, and quarantine to prevent the entry of further variants of concern. So yun lang, over to you, Lindsay.
Thank you very much to Yusek for your updates. I will now be going through the questions sent to us by our media partners. From Bernadette Reyes, Yusek, according to a consulting firm, tumataas daw po ang positivity rate sa National Capital Region at nakikita nila ang trend na magsispike na naman ang cases after several days na nagiging stable. Same po ba ang observation ng DOH?
Katulad ng lagi naming sinasabi, Bernadette, no, na simulat sa poll, sinabi naman natin, ang mga kaso ay patuloy na tataas. And based on our projections, nakita po natin na kapag ka tayo ay nagpatupad ng ECQ na 2 linggo and then MECQ, which is what we are doing right now, but just on the second week of MECQ, makikita ho natin na kahit na nagla-lockdown tayo, patuloy pa rin tataas ang kaso. Pero ang kailangan nating tignan, ilan doon sa pagtaas ng kaso o mga kasong nakikita natin are severe and critical. Yun po ang pinaka-importante sa atin ngayon. So I just like to inform the public, tataas pa po ang ating mga kaso at patuloy itong tataas, maari hanggang Setyembre ay tumataas pa rin ang mga kaso, pero ang kailangan lagi nating alalahanin, we keep those severe and critical cases to that minimum level para po hindi ma-overwhelm ang ating health system capacity. Pangalawa, tumataas ang kaso dahil sa characteristic po ng Delta variant, which we all know that is highly transmissible compared to the other variants of concern. Pangalawa, kailangan natin maisip na lahat po ng ating mga local governments ngayon are intensifying or aggressively responding. They are doing active case finding, kaya nakikita natin tumataas po ang ating testing capacity sa bawat lugar dahil sila po ay talagang aggressively identifying close contacts at yung mga taong may simptomas sa kanilang lugar at pinapatest natin. So that is one of the reasons why our positivity rate are really increasing among all the regions in the country. Pero kailangan nga rin nating isipin na because of this active case finding, ito po ay nakakatulong, no? Kaya tumataas at tumataas pa rin ang mga na-identify natin na positibong kaso.
Thank you po, Yusek. With that, ano po ang recommendation ng DOH since mataas pa rin po ang hawaan given na may mas contagious po ang Delta variant? And for every COVID patient na may Delta variant, ilan po ang nahahawaan niya at gaano kabilis?
Well, ang Delta variant, no, base sa ebidensya, sinasabi ang isang taong may sakit na COVID-19 at variant niya ay Delta, siya ay maaaring makapanghawa mula 5 hanggang 8 tao. Kaya pag tinignan natin ngayon ang pagtaas ng kaso, napakabilis because exponential ang kanyang increase. Kasi kung halimbawa, meron ka lang sabihin mo na 5 positive patients doon sa inyong lugar, kapag nakapanghawa siya, you will multiply that already by 5 or 8, no, up to 8. So ganun kadami ang i-infect sa bawat araw na nakakapanghawa-hawaan. So ano ba ang kailangan natin lahat gawin? Aside from preparing our healthcare system, kailangan putulin natin yung transmission. Putulin ang transmission doon sa pinagmumulan ng transmission at ito po ay ang ating mga komunidad. That's why we are recommending that we do granular lockdowns para po doon pa lang sa community pinuputol na natin ang transmission ng kaso and therefore maari po natin mapababa ang mga taong nangangailangan ng ospital at hindi po ma-overwhelm ang ating healthcare system.
Thank you, Yusek. From Marites Eliano, COVID deaths breached 5,000 in 28 days in August. Lahat po ba ng deaths ay confirmed COVID through RT-PCR? And what can the DOH say about arguments that some of these deaths were caused by complications or comorbidities and therefore should not be counted as COVID-19 deaths?
Kasama po yan, ano? Sa unang-una, ito pong lahat ng nire-report natin are confirmed COVID-19 cases. Kapag po namatay ang isang COVID-19 death, ito po ay naitatala kasama dito sa ating nire-report pang araw-araw sa number of COVID-19 deaths. Pero binavalidate pa ho natin itong mga deaths na to. Hindi po lahat ng namamatay because they had COVID ay naisasama sa ating talaan. Halimbawa po, ang isang tao ay nasagasaan. Siya po ay tinest na COVID-19 at positibo po siya. Wala siyang simptomas na COVID-19 pero bigla siyang namatay because of his injuries dahil nasagasaan siya. So hindi po natin yan itatag as COVID-19 death. Now as to the comorbidities or those seniors, no, so nakikita pa rin po natin yung same trend natin sa ating mga facilities na mga nakakakita tayo ng mga pagkamatay, most of those dying are those with comorbidities and are senior citizens, no? So ito pong mga ito leads for them, no, to be more vulnerable. At yung risk nila of being hospitalized and dying ay napakataas. Kaya po sila ay talagang pinoproteksyonan natin at gusto natin nga mauna silang magpabakuna. So when it comes to death, kapag namatay po sila, we still count them as COVID-19 death. Na-aggravate lang po yung COVID niya at medyo siguro bumilis ang kanyang pagkakamatay dahil po meron siyang ibang angking sakit, no, yung comorbidity niya that makes his body more vulnerable to succumb, no, to the complications of this disease. So naitatala pa rin natin na kasama pa rin yan. Kaya ang amin pong paalala sa ating mga kababayan, magpabakuna po, lalong-lalo na yung ating mga nakakatanda at saka yung mga taong may comorbidities.
Thank you po, Yusek. May we get an update po to the release of the special risk allowance from the 20,000 recipients of the 311 million? How much have been issued already?
Yes, no. So this 311 million, naibaba na po natin ito sa ating regional offices last August 27, no. So as soon as the DBM has released these funds, naibaba po natin sa regional offices. And yesterday, 237.28 million were already disbursed to our local government and private hospitals. So meron po tayong about 74.5 million na ready na rin po ang mga cheque for distribution to various LGU and private facilities. I'd just like to clarify that this 311 million were additional healthcare workers which were submitted beyond our deadline pero ina-accommodate po natin sila ngayon. At sa ngayon po, nanghihingi pa rin tayo ng listahan dun sa mga hindi pa nakakatanggap at ihahabol po natin para makapag-request pa tayo ng budget from the Department of Budget and Management. We already requested for the second batch of funds para po dun sa mga karagdagang pang nakapagsumite sa ating mga regional offices. At inaantay lang po natin na matugunan ng DBM ang pag-release ng pondong ito para makapagbigay po tayo further to our healthcare workers.
Thank you very much po, Yusek. Yusek, if we could also clarify yung paano po nakukompute and magkano po yung nare-receive na SRA ng ating healthcare workers. Meron po kasi ilang social media posts na lumalabas po na supposedly yung SRA payment worth 227 pesos. If you could explain lang po, ma'am, how the SRA is being computed.
Yes, no. So Manny, unang-una, natawagan namin yung healthcare worker na yan, naipaliwanag namin sa kanya. So we went through our regional office para maipaliwanag doon sa ating healthcare workers kung bakit ganun yung computation. Kailangan po maintindihan ng lahat, no? Ang special risk allowance nakalagay po doon sa ating mga guidelines, 5,000 po iyan. 5,000 and it is prorated. It means that when you say it's prorated, it will depend on the number of days that you went to work and cared for a COVID-19 patient. So hindi po yan magkakapare-pareho na across the board bibigyan natin ng 5,000 kasi hindi po yun ang sinasabi ng polisiya. So yung polisiya, yung 5,000, i-divide natin yan sa 22 days. Kasi yan yung number of working days that we use, no, kapag tayo ay nagko-compute for a certain month para sa atin sa gobyerno. Ngayon, kung halimbawa, ikaw ay pumasok lang ng 2 araw, i-compute natin ngayon. So, dinivide natin yung 5,000 across 22 days. 2 araw ang iyong ipinasok. Yung 2 araw na yun, makukuha mo, prorated yon. So, maaari ang ibang mga healthcare workers natin, they receive small amounts. This is what your facility submitted to us as to how many days you went to work and cared for the COVID-19 patient. So yun lang po, tinutugunan lang natin yung mga sinusumiti sa atin ng mga requirements at compliances at dun po namin binabase kung magkano ang ibibigay natin for healthcare worker. So let me reiterate, kahit po nakalagay na 5,000 ang ibibigay for SRA, it is still prorated. So kung ilang araw po kayong naibigay at nagkaroon ng validation na kayo po ay nakapasok at nag-care for sa COVID-19 patients natin, doon po natin itatalaga kung magkano ang inyong matatanggap. So ito pong issue na ito na i-close po natin yan over the weekend. Tinawagan po natin yung concerned healthcare worker. Nagpaliwanag po tayo kung bakit gano'n.
Thank you po, Yusek, for your clarification. From Rafael Bosano, Dr. Solante said that it would be advantageous if tests were given to the public for free, since some patients with household transmission only test one member of the family because of the cost of the RT-PCR test. Is this feasible po ba, or is the DOH looking for ways to further decrease the price of tests?
Yes, Rafi, no, actually last IATF na i-present na yung bagong price cap for RT-PCR tests. I just can't announce it yet kung magkano and all. It's going to be IATF and the concerned agencies, DTI and DOH, to release the policy. Pero naibaba nila yung price cap nitong mga test na ito, and also ang rapid antigen test kits ay nakapaglabas na rin tayo ng SRP para dito, para hindi rin masyado nagkakaroon ng excessive pricing para dito. So ang ating antigen test kits ay 960 pesos po ang nakalagay, kasama na dyan yung operational cost ng mga laboratorio. So as to the RT-PCR and yung recommendation po, tayo naman po ay open to that. Actually, simulat sa poll, nagkaroon na tayo ng PhilHealth reimbursement, no, para dito sa RT-PCR, para hindi po ganun kabigat ang ibabayad ng ating mga kababayan dito po sa mga test na ito. And aside from that, meron pa po tayong polisiya dahil nagbibigay tayo ng libreng mga testing kits sa mga laboratorio na kapag sila ay nagpa-test sa isang laboratory, dapat operational cost lang ang binabayaran nila dahil donated po namin ang mga kits na yan. So ito pong mga ito ay nakatalaga doon sa PhilHealth policy na meron po na 3 klase po ang kanilang reimbursements for testing. So ito po ay isa sa tulong na binibigay ng gobyerno para mas maging accessible ang RT-PCR test kits. Pero kailangan malaman din, for other local government units, they offer this for free. Lalong-lalo na ngayon na tumataas po ang mga kaso, nagbibigay po tayo ng mga libreng testing kits sa ating local government so that they can appropriately do their active case finding at makapagbigay po sila ng libreng serbisyo para sa ating mga kababayan.
Thank you po, Yusek. Yung average na 68,000 daily output na daily testing output in the past week, may target po ba na pataasin pa din ito para in a way bumaba din ang positivity rate?
Well, yes. Meron tayo laging target for testing, no? Nung pauna, ang target natin nasa 70,000. Sumunod na sinasabi, it's 90 to 100,000 so that we can be able to decrease our positivity rate to 5%. But these are all technical, di ba? It's based on computation and all. But ang kailangan natin isipin, itataas natin ang pagtetest para mas marami tayong makahanap na mga positibo na kaso, ma-isolate natin agad, maputo lang transmission. So once transmission had been reduced, we can see positivity rate decreasing as well. So kasabay ng pagtetest na yan, kailangan talaga ang ating mga local governments will do active case finding so that we can be able to stop the transmission in our communities.
Thank you very much po, Yusek. Aside po from the NCR and Calabarzon, may mga lugar na po ba tayong nakikita na mataas ang prevalence ng Delta variant?
Yes, no? So we have Region 3 in Bataan actually. Dun sa mga ibang lugar, meron na rin. Kahit sa CAR, meron na rin. Sa Region 1, meron na rin. Region 2, meron na rin. Actually, lahat ng regions except for one, which is BARM, na meron na rin po tayo. Nakitaan din natin ng Region 10 na mataas na prevalence, pati po ang Region 6. Mataas na prevalence itong Delta variant. So nakikita na ho natin siya, and actually, in our latest sequencing run, 69% or almost 7 out of 10, no, na tinetest natin ay Delta variant na po ang lumalabas.
Thank you very much po, Yusek. From Red Mendoza, sa dumadaming kaso ng COVID-19 sa bansa, some people are saying na granular lockdowns may not work anymore and instead should do a new strategy in combating the virus. Ano po ang reaction ng DOH dito sa suggestions na hindi na raw nag-work ang granular lockdowns dahil sa nearly 20,000 cases in the country?
I beg to disagree, Red. Because yung ginagawa natin dati na mga malakihan na lockdown, no, yung mga province-wide o kaya ay and region-wide na lockdowns, yun po yung na-evaluate ng ating mga eksperto at ng data analytics team ng IATF na mukhang not working for us anymore. Because ang dami ng modifications, ang daming apors na pwede nang lumabas, and That is understandable kasi people needs to work, no? Kasi nagugutom na ang mga tao. Pero base dun sa nakita natin, mobility ay napakataas pa rin. Tapos dito sa mga ginagawa natin ng mga hard lockdowns, meron pang isang indirect effect, which is hunger and more diseases, for especially for those people na nandun sa lower level of class ng economy natin. Kaya atin pong napagdesisyonan at magre-rekomenda tayo actually na dapat more on granular lockdowns. Ibig sabihin, sa isang lugar, pag tinignan mo ang isang lugar, di naman lahat ng barangay niya ay apektado minsan. Ano? There would just be about 50% maybe of their barangays and the rest, hindi naman po sila ganun kadami ang kaso. So in order for us to be able to implement well the response that we would want to see from local governments, we are recommending granular lockdowns. Itong granular lockdowns na to, mahigpit po yan. Napapanood nyo sa TV, walang pwedeng pumasok, walang pwedeng lumabas. Kapag pumasok ka na, hindi ka na pwedeng lumabas. O kapag ikaw ay lumabas, hindi ka na pwedeng pumasok. Visibility and enforcement is there. They are being guarded by our local government officials na talagang minomonitor sila at tinitignan if they are complying with this granular lockdown. Pangatlo, dito po sa granular lockdown, magagawang maigi ng local governments ang active case finding, vaccination, at of course, yung enforcement ng ating minimum public health standards. So, if our local governments, no, actually nakakausap na natin sila for these past weeks and sila naman po ay amenable to this kind of arrangement, kung magkakaroon po tayo ng ganyan, we will be able to stop the transmission sa community. Sabi ko kanina pa, di ba, aside from preparing our health system, aside from doing the other response that we need to do, stopping the transmission in our communities is foremost ngayon. Kailangan natin putulin ng transmission kasi kung hindi natin mapuputol ang transmission kung saan ito nanggagaling, hindi po titigil ang pagpasok ng tao sa ospital at mau-overwhelm po ang ating health system.
Thank you very much, Yusek. Ma'am, is it okay if we still accommodate a few more questions from the Zoom chat box po? I'll now be going through them. From Red Mendoza po again. In an interview, an expert wants the government to revisit its booster guidelines as he sees breakthrough infections daw po on a certain vaccine brand after 6 months. Ano po ang reaction ng DOH dito and will it be converted into a possible policy?
Sa pagkakaalam ko, ang vaccine expert panel at ang all experts group ay nakapag-usap ukol dito sa booster dosing. And the head of the vaccine expert panel, who is Dr. Nina Gloriani, nakapagsabi siya na hanggang sa ngayon, wala pa tayong kompletong ebidensya at pag-aaral kung gaano katagal tumatagal ang immunity ng isang tao base sa kahit na anong klaseng bakuna na meron tayo sa ngayon. Pangalawa, sinasabi rin ng ating all experts dun sa pag-uusap namin na yon na base rin sa pag-aaral, marami na pong lumalabas ngayon ng mga second generation vaccines. Ito po yung mga undergoing clinical trials ngayon kung saan inayos na ng mga manufacturers ang bakuna para maka-adapt dun sa ever-changing or mutations that these viruses are doing para mas protektado tayo pagdating ng panahon na yan. So having heard from them these evidences and evaluations that they have done, the consensus of our experts were, unang-una, huwag muna tayo mag-booster ngayon. Hindi pa kompleto ang evidence para sa safety, hindi pa kompleto ang ebidensya para dun sa length of immunity ng bawat bakuna. At gusto natin, baka umabot naman, titignan natin na makaka-procure na tayo nitong second generation para hindi itong old vaccines ang ibibigay natin as booster na ganun din. Ang efficacy niya is affected also by this Delta variant. If we can have better vaccines, why not, di ba? So sa ngayon, ang kanilang rekomendasyon, tayo ay mag-focus muna na mas mabakunahan ang mas nakakarami. Dahil ang dami pa rin po dito sa ating bansa ang hindi pa ho nababakunahan kahit isang dose pa lang ng bakuna. Nakikita ho natin ang effectivity. Yes, we have breakthrough infections. Hindi po natin itatago yan. Marami pong nagkakasakit. Hindi lang sa isang klaseng bakuna, sa lahat ng klase ng bakuna na meron tayo. Pero pag tinignan ho natin ang severe and critical, napakababa po para po dito sa breakthrough infections na to. Hindi po pinangako ng bakuna na ito na 100% hindi na tayo magkakasakit from COVID-19. Sinabi rin dun sa mga ebidensya, it cannot block transmission totally. The efficacy against symptomatic disease across these vaccines, hindi po ganun kataas. Pero ang pangako niya po, ang pangako ng mga bakunang to, this will prevent us, no, will reduce tremendously yung pong risk natin from having severe infections, being hospitalized, and even dying. So yan po ang atin pong nirerelayan ngayon at nakikita po natin dito na, real world, dito sa Pilipinas, nakikita natin na nangyayari naman po ang proteksyon na yan dito po sa ating population. And because of all of this, recommended po ng ating experts, let's not do boosters for now. Hindi po natin sinasara ang pinto, patuloy na pinag-aaralan, especially para sa healthcare workers at saka sa mga vulnerable population. Pero sa ngayon po, ang desisyon pa rin, base sa rekomendasyon at desisyon ng ating gobyerno, wag muna tayong mag-booster, bakunahan muna po natin yung mga ibang mga nangangailangan pa rin ng kanilang first dose. Dadating tayo dyan sa point na yan, hindi po natin sinasara ang pintuan natin.
Thank you po, Yusek, for the clarification. From Dreo Calonzo, how prevalent or rare are people taking third shots right now despite the DOH discouraging this? And what factors have you identified that allow people to still get their third shots despite yung hindi po natin siya ina-allow pa?
Maraming factors, no, Dreo? Merong iba, gusto nila mas maprotektahan sila. Iniisip nila na sila ay mas mapoprotektahan kung may third dose. Marami kasing misinformation tsaka disinformation na pinapakalat na sinasabi na ganito ang bakuna, substandard and all, which is all false. Dahil nakikita naman po natin na ang mga bakuna ngayon natin ay nag-work for us. Look at what's happening in the National Capital Region. Example lang po yan, mataas po ang pagbabakuna sa NCR at nakikita natin unang-una yung projected na 83,000 active cases projected for NCR by the end of August 30. Hindi po natin narating yan. We're just 41,000 cases here in NCR currently, active cases. So ibig sabihin, we are doing something good. Pag tinignan natin yung severe cases natin, last week po, nasa almost 3% ang severe and critical sa NCR. Ngayon po, it's down to 1.6%. So nakikita ho natin that with all of these things that we are doing, meron pong epekto, no? And we would like to assume that part of this would be the vaccines that are giving us that protection. So ibig sabihin, itong mga taong nakakakuha ng mga misinformation, disinformation, nakikinig sila at sila naman, they take advantage, no? Every opportunity they get. Pero sana isipin nyo, yung bakunang itinurok sa inyo na pangatlong beses nyo nakuha, ninakaw nyo ang bakuna para sa ibang tao na dapat sila ang meron at maaring ikamatay nila to. It's a line between the death of an individual versus you getting your contentment kasi nakuha mo yung bakuna na hindi naman dapat sa'yo. So sana po lahat ng ating mga kababayan, magkaroon po tayo ng malasakit sa ating kapwa. Let's follow the protocols now. Dadating tayo dyan sa booster dosing and we commit to the public. Pag nakakuha na po tayo ng sapat na ebidensya, supplies are stable, we will do that, no? Pero wag po nating madaliin.
Thank you very much po, Yusek. From Mark Catalco, 2 weeks na ban ang flight ng Philippine Airlines sa Hong Kong dahil may 3 na nag-positive sa kanilang passengers pagdating sa Hong Kong. 2 hours lang po ang biyahe yet positive agad sila. Ano po ang nakikitang lapses dito ng department and may investigation po ba kung mali ang mga laboratory or fake certificate yung binigay po ng mga pasahero?
Hindi naman siguro fake, no? Kasi meron naman ho tayong mga validation procedures at saka yung atin pong mga tao sa airport, katulad ng Department of Transportation, yung atin pong mga Bureau of Quarantine personnel, works hard, no? Para ma-validate natin, ma-verify natin itong mga dokumentong sinusumite. Katulad ng sabi natin lagi, no? When you have your test, for example, today, bukas, kahit negative ka, bukas you get exposed, you incubate already, no, with the virus. So maaaring ganun po yun nangyari, no? Kasi ang requirement naman ng ibang bansa at ng ibang carriers, pag sumakay ka, pwede ka magpresenta ng 48 to 72 hours na valid yung iyong test result. So maaaring nung time po na nagpa-test siya, hindi pa nakita dahil alam natin na may accurate time period kung kailan tayo magpapatest. and that would be 5th to the 7th day when you were exposed. So baka hindi pa ho natin nakuha dun sa time na nagpa-test sila at during the time na dumating sila dun sa lugar na pinupuntahan nila, dun sila nag-positive because they were still incubating. Marami pong factors at titignan po natin yan. But of course, lagi po nating tinitignan sa banda na paano pa natin mai-improve ang ating proseso pag nakakakuha tayo ng ganitong report. Kaya iniimbestigahan po natin maigi yan para hindi na po rin naman mauulit sa susunod.
Thank you po, Yusek. Next question po. From Mika Hanapol. Recently, we flagged a claim by an actor who said that the COVID-19 virus can go through any mask because its particles are really small and have not been detected. I just would like to clarify if the virus is indeed really small and therefore can go through any face mask. Can you please explain why we use face mask amid the current health crisis and how effective are masks against the virus?
Yes, Nika, no? So, alam mo, hindi lang sa COVID-19 ginagamit ang mask. Simulat sa pulpa na nagkaroon ng mga iba't ibang klaseng infectious diseases, ginagamit na po ang medical grade mask. Pag tayo ay nagpupunta sa ospital, kahit wala pa ho yung pandemya, ang atin pong mga healthcare personnel, usually may mask sila, lalo na dun sa mga sensitive areas sa ospital. Bakit? Ang mask po, pag tinawag na medical grade, it is made out of different layers where you can filter small particulate matters, including viruses. So yung medical grade mask po, kaya po ganun ang ating nalang reliance on that, no? Even hindi COVID or non-COVID na sakit, nasasala po niya yung maliliit na mga particulate matters, including these viruses that can be transmitted droplet infection o sabi nga pag nasa loob ng isang setting na enclosed, it can linger longer sa air, no? So ito po nakakaprotekta sa atin. Marami na hong pag-aaral na lumabas diyan that it can protect us, no, as much as 80% na protection pagka medical grade na mask. Pag nasa ospital tayo, ang requirement po natin na PPE N95 mask. Mas mataas po ang filtering mechanism nito mga N95 mask, mas nakaka-prevent para pumasok ang virus at makmalanghap natin sa ating bibig at saka sa ating ilong. Kaya hindi po totoo na ang mask ay hindi nakakasala itong mga virus na ito. Kung wala pong gumagamit ng mask dito po sa ating bansa mula nang pumutok ang pandemya, ay maaari pong napakataas na at milyong-milyon na po ang kaso natin dito sa ating bansa. So sana po ang ating pong mga nakikinig, ang ating pong mga kababayan, maging mapanuri po tayo sa sinasabi po ng mga ating ibang kababayan. Ano? Kung tignan natin kung tama yung sinasabi nila, kung tama gawin natin, pero sa kasong ito, mali po ang sinasabi niya. Gusto ko lang magpaalala sa ating kababayan na sana po tamang impormasyon lang ang ating ipamahagi sa ating mga public, no, para hindi po tayo nami-mislead sa ating mga ginagawang aksyon. Gusto ko lang idagdag, no, there's this specific individual in the United States na kinontra niya ng kinontra ang pagsusuot ng mask. At nung time na yon, may asawa siya, may pamilya siya, hindi siya nagmamask, ayaw niyang makinig at sinasabi nga niya na hindi daw kailangan at hindi ito nakakatulong. Ngayon po may sakit siya na COVID-19, nasa ospital po siya ngayon and he has severe infection of COVID-19. So I'm not saying anything, gusto ko lang ibigay na halintulad dahil gusto kong i-emphasize yung importansya po ng mask para sa ating lahat. So patuloy po tayo mag-mask. Ang importansya at value niyan ay wala pong kapalit para sa atin. Ito po ay nakakaprotekta sa atin at sa ating mga pamilya at sa ating komunidad.
Thank you po, Yusek. Ma'am, do we have latest updates daw po regarding yung stocks natin ng remdesivir and tocilizumab?
For tocilizumab, we're having challenges sa ngayon. Kausap natin yung manufacturers and even across the globe, nagkakaroon na ng competition at tayo ay sumulat na sa embassy natin ng Switzerland and United States para magpatulong tayo if we can be provided that reserve, no, na allocation kahit man lang portion of what should be given to other countries ay makahingi tayo para mabigyan din po ang ating bansa dahil talagang nahihirapan po tayo mag-source out ngayon ng tocilizumab. Dito po sa remdesivir, meron pa ho tayong mga stocks sa ibang ospital natin dito sa ating bansa. And we don't see any parang problems with remdesivir currently because we have a direct line also with the supplier. Ito lang pong tocilizumab. And sa ngayon po, pinag-aaralan ng ating mga eksperto, our Living CPG group also, ito pong mga alternative to tocilizumab. Meron pong mga binabanggit na mga pangalan ng gamot na magiging alternative for tocilizumab. But of course, we need FDA to vet it, and also our clinical guidelines should be there so that it can be used by our hospital. So antayin po natin yan, but we are continuously trying to negotiate with suppliers for these tocilizumab vials.
Thank you very much po, Yusek. From Caroline, paano po yung mga cases of reinfection na isasama po ba siya sa current count natin, yung second infection po?
Yes, Caroline, no? As long as you get to have RT-PCR result na positive, nasasama siya. Ngayon, yung para itanggalin natin kung sinong reinfection and hindi, pinag-aaralan pa natin yan. Sa dami po nung mga pumapasok ngayon na mga kaso, we will get to that information maybe in a month's time.
Thank you, Yusek. From Jessel, after bakunahan against COVID-19, bawal po ba magbuntis? And just to clarify lang po, ang bilin ng ilang vaccination site na bawal magbuntis ilang months after bakunahan. Ano pong explanation dito? And may latest po ba, if you have the latest data, ma'am, kung ilan ang hindi pa bumabalik for their second dose?
Wala tayong ebidensya at pag-aaral na nagsabi na bawal kang bakunahan, bawal kang magbuntis pagkatapos mo ikaw ay mabakunahan. Wala tayong ginawang trial or ginawang pag-aaral ukol dyan. Pero ibase po natin dun sa ating protocol sa mga buntis, na katulad po ng sinasabi nga ng ating mga eksperto and even our OBGYN society has recommended this, na importante po ang bakuna para sa ating mga nagbubuntis at para magkaroon po tayo ng pagpapaliwanag, the benefit will always outweigh the risk. Now, doing it other way na mabubuntis ka pagkatapos, I think the same goes na naging safe naman siya na ibinigay natin sa mga buntis. So kung magbubuntis ka, sa tingin namin ay wala naman po tayong pang sinasabing ebidensya that can lead to some ill effects dun sa baby na isisilang mo. Pero of course, kailangan pa rin nating magkaroon ng vetting process with our health experts para mas mabigyan po natin ng tugon itong katanungan na ito. As to the hindi bumabalik or defaulters, I do not have the data right now, but we will post it in our Viber.
Thank you very much po, Yusek. Yusek, ano daw po ang posisyon ng Department of Health sa vaccine bubble na nire-recommend po ng ilang private sector, and kung saan may nakabukod na transportation at papayagang mag-9-in ang mga vaccinated? Doable ito given our current vaccine coverage?
Sa ngayon, pinag-aaralan yan. At hindi po namin isasara yung pintuan namin din sa ganyang usapin. Dadating po tayo sa punto na yan. Once supplies are stable, once vaccine coverage has improved already, not just here in NCR but also in the other regions, and once our cases are already manageable. Pero sa ngayon po, sa tingin namin, hindi pa ho natin pwedeng ipatupad yan base sa Department of Health's analysis. Dahil nakikita natin, for example, dine-in, this is an enclosed space. And dito po sa mga nire-recommenda natin mga protocol sa ngayon, hindi po natin nire-recommenda na magkaroon po tayo ng dine-in in enclosed spaces dahil nga po sa threat ng Delta variant.
Thank you very much, Yusek. Ma'am, I'll go through the last question na po since you have your next appointment na. From Jessel, may mga bata with comorbidities daw sa Tacloban ang binabakunahan na against COVID gamit ang Moderna o anumang available vaccines. Sinasabi ng City Health Officer nila na 17 going to 18 naman itong mga bata at may clearance from pediatric cardiologist. If that's the case, pinapayagan po ba ito, and ano po ang recommendation natin regarding this?
Well, nakausap na ho namin yung City Health Officer dyan. We have flagged this also to our regional office. Sa ngayon po, ang protocols natin, hindi pa rin tayo nagbubukas ng pagbabakuna para sa mga bata, even those with comorbidities. We would like to stabilize our supplies first ipauna muna natin yung mas vulnerable na mas nakakatanda at mga tao may comorbidities. And then vaccinations for children will follow din naman po. Basta nagkaroon tayo ng more evidence on safety and our supplies are enough already. So we have flagged this with the regional office in Region 8, and we have asked them to discuss this with the City Health Officer of Tacloban. Dahil kahit naman po pinayagan niya ng kanilang pediatric cardiologist, pero ang national government protocol ay hindi pa yan pinapayagan, hindi po nila dapat ginagawa yan.
Thank you po, Yusek. Before we officially end our media forum, do you have any final messages po para sa ating public?
I just like to say thank you to all of you. Alam ko po ang media partners natin ay katulong natin sa pagpapakalap ng tamang impormasyon para po sa ating mga kababayan. So sa pagtatapos po ng ating media forum ngayong araw na to, gusto po naming bigyang diin ang kahalagaan ng ating preventive measures para maiwasan po natin ang pagkalat ng COVID-19. Ang minimum public health standards kasabay ng pinag-igting na PDITR strategies ng local government units natin at ang pagbabakuna kontra COVID-19 ay nananatiling epektibo laban sa mga variants of concern. Hindi po kami magsasawang magpaalala sa ating mga kababayan na isa puso at isa isip ang pagsunod sa minimum public health standards. Hindi po sapat na sinabi nating naka-face mask tayo, isuot po natin ng maayos ang ating face mask at face shield. Hindi po sapat na tayo po ay nakapag-ugas ng kamay, ugaliing mag-ugas ng kamay na mayroong sabon at kailangan 20 seconds po at least, para naugasan po natin ang pangkalahatang parte ng ating mga kamay. Hindi po sapat na mag-physical distancing tayo kung wala pong sapat na ventilasyon. Kailangan maayos po ang daloy ng hangin dun sa ating pupuntahan in enclosed spaces. Hindi po sapat na alam po natin ang tamang impormasyon. Kailangan na po nating ibahagi at i-educate ang ating mga kapamilya, mga kaibigan, mga kapitbahay at ang ating buong komunidad para po tayo lahat ay tama ang impormasyon, alam natin ang ating gagawin, and we are guided kung ano po ang mga mabuti para sa kaligtasan natin from COVID-19. The whole of nation, the whole of government, the whole of society approaches were and will always remain to be effective in our overall COVID-19 response. Ang kooperasyon po nating lahat mula sa ating mga local government units, national government agencies, at iba pa hong sektor ay mahalaga upang mapanalo po natin ang laban na ito. Asahan niyo po ang patuloy na pagkilos ng ating gobyerno sa pagresponde sa COVID-19 at marating po natin ang ating kinabukasan na inaasam na magkaroon tayo ng Happy Christmas, magkaroon po tayo ng new normal na tinatawag natin kung tayo po lahat ay magsasama-sama at makikiisa para masugpo natin ang sakit na ito. So maraming salamat po sa inyong lahat, and we will see you on our next media forum. Thank you, Lindsay.
Thank you very much, Yusek, and maraming salamat po to all our media partners. Have a nice day po and ingat po tayong lahat.